Okay, good evening, everybody, and welcome to this event on attacks on healthcare from the Syrian civil war to Gaza and Khartoum. It's an event co-organized by the Geneva Center of Humanitarian Studies at the Faculty of Medicine here at University of Geneva, and by the Global Health Center at the Graduate Institute with my dear colleague, Professor Vinkim Nguyen. It's a pleasure and a privilege to organize such an event in an academic institution. It is important to have these kind of discussions. And this is why I would like to thank our university for giving us permission and giving us as well support to organize this kind of event, and to our dean at the Faculty of Medicine, who is very, very supportive to have this kind of open discussion of these important issues. This event is organized in three different sessions, three different parts. In the first part, we're going to have the privilege to hear from Dr. Ghassan ABU-SITTAH, who comes from Beirut, who has a long experience working in Gaza, and has been a very strong voice on these issues, followed by a panel discussion facilitated by Professor Nguyen, with three great panelists who have joined Dr. ABU-SITTAH. Professor Larissa Fast, who comes from SCHRÖTER at Manchester University, who is a close colleague of mine working on various issues on the impact of healthcare, of attacks on healthcare. Avril Patterson, who is the head of health at RCRC, at the International Committee of the Red Cross. And Dr. Martin, who is a consultant at WHO and working at the Graduate Institute and at the London School, so many hats. But without any waiting, I would like to thank our Vice-Rectrice, our Vice-Chancellor, Juliane SCHRÖTER, who is going to open the event. Thank you very much.
Good evening, everyone. On behalf of the University of Geneva, I would like to welcome you to the lecture and roundtable discussion, Attacks on Healthcare, from the Syrian civil war to Gaza and Khartoum. In the next approximately 1.5 hours, we will have the pleasure of listening to a keynote by Ghassan ABU-SITTAH, Rector of the University of Glasgow, who has also worked as a war surgeon in Yemen, Iraq, Syria, South Lebanon, and also in the Gaza Strip. His keynote will be followed by a discussion with Larissa Fast, Avril Patterson, and Martin van der Heijden. A warm welcome to all of you who have accepted to share your experience and insights with us. We are excited and proud to host this high-level event here at the University of Geneva, which addresses the protection of healthcare in armed conflicts. At the same time, we are, of course, deeply troubled and concerned to have to host this event. This might seem a contradiction. To put it more precisely, we're deeply troubled and concerned about the fact that the topic of our evening tonight has become more and more important over the last years. The World Health Organization publishes the so-called SSA, that's the Surveillance System for Attacks on Healthcare. It's a system which monitors attacks on healthcare, be it attacks on facilities, or on patients, health workers, transport, or supplies. For this year only, the year 2025, the system has already registered 523 attacks and 1,033 deaths in 13 territories. For example, in the occupied Palestinian territory, in Sudan, in Syria. 5 attacks have only occurred over the last week, all in Ukraine. And of course, we have to keep in mind the number of unreported cases, which is probably considerable. Over the last years, not only the World Health Organization, but also the International Committee of the Red Cross, or NGOs such as Physicians for Human Rights, have continuously alerted us to the risk that attacks on healthcare could become the new norm in armed conflicts. As Larissa Fast, one of our participants in the discussion, and Karl, one of the organizers of this event, have rightly pointed out in a paper from 2023, quote, "The scale of attacks on healthcare has become more visible and its impact greater in recent armed conflicts. In these conflicts, combatants systematically target health facilities and ambulances. This trend is, of course, all the more disturbing in light of the ongoing funding cuts for humanitarian aid and humanitarian organizations, and in light of what seems to be a retreat from multilateralism. So the topic, which we will discuss tonight, is highly relevant. It's particularly relevant to the University of Geneva. To quote from its 2024 to 2034 strategic plan, "The values of the University of Geneva are deeply rooted in the long-standing humanistic traditions of our host city, Geneva. These include respect for human rights and appreciation for people in all their diversity, along with a strong belief in international dialogue and the open exchange of ideas. For this dialogue and this exchange, of which our lecture and discussion tonight are part, we need freedom of expression and we need academic freedom. In a position paper which has only been published last week, the Rectorate has underlined the importance of freedom of expression and academic freedom in order to enable free and informed debates at the university and beyond. But at the University of Geneva, there is also a tradition and a lot of experience in research and development that directly benefits the solution of humanitarian problems. I think, for example, of InZone, a program which aims to bring new higher education solutions to learners in fragile contexts, for example, to refugees. I also have in mind the Geneva Center of Humanitarian Studies, which offers programs and research from which humanitarian professionals can directly profit. It is also the Geneva Center of Humanitarian Studies of our Faculty of Medicine, which has organized this lecture and debate, together with the Global Health Center of the Geneva Graduate Institute. Many thanks to the organizers, and also many thanks to our partner institution. You made this event possible. Thank you very much. I wish you all an excellent lecture and discussion.
Thank you, Professor SCHRÖTER. Thank you very much. Just a few words before I leave the floor to Dr. Ghassan Abou-Sittah. Hotels on healthcare have taken various shapes and have become a major concern in many countries and contexts. In the recent armed conflict in Gaza, in Syria, Myanmar, Ukraine, and Sudan, the destruction of health facilities and ambulances and the direct violence and threats on personnel, but as well on patients, have escalated. The problem have worsened in the last few years, with belligerents violating the laws of war as defined by the Geneva Conventions. The conventions explicitly prohibit attacking the wounded or the sick, as I quote, or assaulting or punishing military or civilian health workers who offer them care. Significant efforts have been invested over the years. As you pointed out earlier, WHO has created this incredible database on surveillance of system on attacks on healthcare, the SSA, and one of the key funders of this great effort is here in the room. We have the Safeguarding Health in Conflict Coalition as well, who's trying to publish every year and document the number of attacks. And here in Switzerland as well, we have the NGO Insecurity Insight, who is documenting from different sources the number of attacks. We have, with Professor Larissa Fast, a consortium of institutions, universities, Manchester University, University of Geneva, Johns Hopkins, Berkeley, and others, who have joined forces to document the impact of attacks on healthcare, and we have done that quite in a few countries. We have published numerous papers documenting from all over the world different types of impacts. But what we have seen more recently, and even with the many efforts invested by the RCRC, the International Committee of the Red Cross, to actually train the armed forces on the Geneva Conventions, that the numbers, unfortunately, are increasing. If counting and documenting the incidence of attack is not good enough as a deterrent for belligerents to change their ways, perhaps other types of evidence or other messages could be useful to change how these issues are debated. And this is why that the purpose that we have now tonight, this is why we have decided to organize this key event and invite Dr. ABU-SITTAH to actually be the voice and be one voice and to talk about these issues in very different ways. Dr. ABU-SITTAH, as introduced earlier, is a Lord Rector at University of Glasgow. He's also affiliated with the American University of Beirut, but has been a surgeon working in Gaza for many years. I also would like to recommend, I don't know if you've seen recently, has been displayed recently in Geneva, a documentary that is excellent there, Hassan Abu-Sittah, The Reluctant Hero. And we need these kind of voices to actually provide a different perspective in this kind of academic institution. So I'm glad to have a professional here and an academic as well who can tell stories and strong stories. Dr. ABU-SITTAH.
Thank you very much, and thank you for this wonderful invitation. Thank you, Karl and Min Kim, for this invitation. In this talk, what I want to discuss with you is what is unique about what is happening in Gaza, not in terms of only the genocide, but also of the centrality of the dismantlement of the health system to the military doctrine of this war. And it is a dismantlement rather than attacks. And I will look at the different components of the dismantlement of a health system, and then hopefully use some of the case studies happening in Gaza, and then touch on why this is going to be critical for the rest of the globe, for the rest of the 21st century. So, on the 12th of October, 2023, hospital directors in every hospital in the Gaza Strip received a phone call from an Israeli army captain telling them that unless they evacuated the hospital from patients and staff, the hospital will be targeted. So this was early October 2023. And I was actually sitting with Dr. Ahmed Mhanna, who's the director of Al-Awda Hospital in Jabalia camp, when he received that phone call from an Israeli army surgeon. And then, very quickly, there was a decision by the Palestinian health system that this is a prelude to ethnic cleansing and that hospitals were not going to evacuate. We then soon started having a narrative being drawn by the Israeli government, by the Israeli army, militarizing the Palestinian health system and justifying any future attacks. So Israeli politicians, Israeli army, press releases, and as you recall, the famous press conference by the Israeli army with all of these graphics showing underneath Shifa Hospital all of these different command and control centers, started to weave a narrative that the Palestinian health system is in fact a military industrial complex rather than a health system in a besieged part of the third world which had been besieged for 17 years. And with that, there was a communique by 150 Israeli doctors that was paid for and published in one of the Israeli newspapers, calling on the Israeli army to attack Shifa Hospital as a headquarters of terrorists. And so by the end of October, Israeli newspapers had this announcement by these Israeli doctors calling on the army to attack the health system. On the 17th of October, the Israeli army fired a missile, a fragmentation missile, into the courtyard of Al-Ahli Hospital, killing 483 of the civilians that were taking refuge inside the hospital. And the importance of that hospital is that this is a hospital owned by the World Council of Churches. It is run out of the Anglican Church in the UK. And so the Israelis chose the most unlikely target to start with, to send a message, and to use as a tester for what was about to happen. Soon after, the Israeli army started to bomb the vicinity of Al-Shifa Hospital, and Israeli ground forces, whenever they reached the hospital, and within a week, by the end of October, November, they destroyed 3 pediatric hospitals in the northern part of Gaza. These attacks on hospitals and clinics continued till now, until actually what is left of 39 Palestinian hospitals is a single hospital, which is Nasser complex in Khan Yunis. The last attack was the firing of 8 2,000-pound bombs in the courtyard of the European hospital, which rendered the hospital structurally unsafe. We then have the destruction of equipment, and we saw when the Israeli army entered Shifa Hospital the first time, after the first siege in November 2023, before withdrawing from that hospital, Israeli soldiers went around firing rounds into all of the ventilators and all of the equipment, ensuring that that equipment is unusable. We now witness a similar process in the last few weeks where the international community, including the European Union, is trying to get the Israeli army to allow the retrieval of the equipment from the European hospital in Rafah, which is not found in any other hospital in Gaza, because it is the main neurosurgical unit, it has a burns unit, it has a cardiac catheterization lab, but the Israeli army refuses to allow that equipment to be released. So we've looked at the buildings, we've looked at the equipment. Then there's the wiping out of a whole generation of health workers. 1,500 Palestinian health workers have been killed. Doctors, nurses, lab technicians. The risk of being targeted, of being killed or wounded as a nurse or a doctor in the Gaza Strip, compared to the population of doctors and nurses, is 2.5 times higher than any other profession in the Gaza Strip and higher than the general population. So a statistician looked at, from Phoenix University, looked at the total number of woundings and killings to the number of doctors and nurses in the Gaza Strip, compared them to the number of killed from the rest of the population, found that there was an intentional targeting of that profession. And so we now, after this 1,500 killings, of the 5 pathologists that worked in Gaza, only 2 are still alive. There are no kidney specialists alive in the Gaza Strip. There are no board-certified emergency medicine doctors left alive in the Gaza Strip. In the last 27 days, Israel has killed 41 doctors and nurses. But most importantly, and to show that these are targeted killings, of these 41, 10 were intensive care nurses and 1 was head of intensive care in the north. And as we know in medicine, training up a nurse to become an intensive care nurse takes years. And so these are really nurses who are irreplaceable in times of war. And their availability determines the number of intensive care beds that you can operate. But what is clear about the targeting of these health workers is that even a hospital as large as Shifa, which was Gaza's largest hospital, can be rebuilt in 2 years, 3 years. But it takes 12 years to retrain a pathologist from medical school all the way to the end of the residency. A similar number with emergency medicine, with nephrology. And so the wiping out of that generation means that the possibility of rebuilding the health system in a short period is going to be impossible, and that there's a lag, intermediate and immediate phase where these specialties need to be reintroduced into Gaza in the form of emergency medical teams. Then you look at the denial of access of medication and the denial of consumables and of fuel. Currently, there's only 24 to 48 hours of fuel left in the hospitals in Gaza. There has been no medical consumables, medication allowed in since the collapse of the ceasefire almost 2 months ago. And so whenever there is an infrastructure and human resources, there's very little that they can do. The third is an interesting phenomena in this world, in this war, and the way Israel has dealt with it. We have had, first, at the beginning of the war, if you recall, the incidents of Nasser Hospital, which was the pediatric hospital, where premature babies were left to die without oxygen, without electricity. And when the ICRC team went in, their bodies had been laid out on trolleys by the withdrawing Israeli soldiers. We also have the incident in the second siege of Shifa Hospital, where Israel killed 400 doctors, nurses, and patients, and then their bodies were buried in shallow graves inside the courtyard of the hospital. And this, for me, is an intentional way of reconfiguring Palestinian health system and Palestinian hospitals from spaces of healing and of resistance to the politics of death to the mass graves, so that Shifa will always be remembered as a mass grave rather than as a place that had treated generations of Gazans with each war. So we've taken away the buildings, we've taken away the equipment, we've taken away the people who can provide the health care. We've prevented the consumables and the medication and the fuel that the system needs to run on. And hospitals became the most dangerous place in Gaza to be targeted. The next stage came after the collapse of this ceasefire and the intentional famine. And so medical teams now describe the acute malnutrition as being a main reason why the wounded children are unable to heal following injury and following surgery to their injuries. And so you've taken away the health system, and now you've taken away the body's ability to recover from injury. Over 70,000 children have severe acute malnutrition, and when these children are wounded, their bodies are unable to heal. And if they need surgery, we've had British surgeons describe how laparotomy wounds have reopened, not from infection, but from the inability of that body to heal after the surgery. So what does that mean? Well, if we look at what happened to Gaza's 1,400 dialysis patients that existed before the war, the other day the WHO announced that 42% of them have died, none from traumatic wounds. And the reason they died? Well, it's because all of the dialysis units had been repeatedly bombed, and the last one last week was the remaining dialysis unit in the northern part of Gaza. All of the nephrologists had been killed. The consumables and the medication that you need to run a dialysis unit have been prevented from entering. These fragile dialysis patients with kidney failure and other comorbidities, after the dialysis, go back to living in tents, are being forced to dislocate one time after another, and are malnourished. And so it's not surprising that these patients have died as a result of this genocide, but not the direct part. So that takes us to this idea that what has been created in Gaza by Israel is a biosphere, a social, physical, and biological ecology where people live, and where that ecology injures them and kills them beyond the bullet and the bomb. So in the last 24 hours, a group called the Harvard Data Set, using Israeli army data, estimated that 400,000 people have died in Gaza as a result of this genocide. So 12.5% of Gaza's population. Of these people, only around 100 to 110,000 were traumatic deaths, which means that this biosphere, the infectious diseases, the destruction of the water and sewage, the destruction of the health system that we spoke about, the malnutrition, all of this has become weaponized in a way that people are being killed beyond the direct military intervention. And the differential between the 400,000 and the traumatic deaths of around 100 to 110,000 are the people like the dialysis patients, are the cardiac patients who died because there is no access to a cardiac catheterization lab, or the cancer patients, are the infectious diseases that have ravaged people in Gaza, diarrheal diseases, hepatitis in the hundreds of thousands, because of the destruction of the water and sewage, because of the destruction of 90% of homes, and people having to live in overcrowded schools that have become centers for the internally displaced. So in addition to dying from the bullets and the bombs, they're dying quietly from this biosphere of genocide that has become weaponized as a way of taking lives. So what does Gaza teach us about the rest of the world and the rest of this century? Well, my contention is this. Scorched earth policy, which was a military tactic and doctrine that was started in the 60s and 70s, happened when the majority of the world's population lived in rural areas. And so in order to make these areas uninhabitable, you had things like Laos, where you had hundreds of millions of bombs dropped during the war. In Vietnam, the use of defoliating Agent Orange. In Angola, millions of landmines in order to create that uninhabitable land. In the 21st century, the overwhelming majority of the population is urban, of the world's population is urban. And the majority of the world looks a lot like the Gaza Strip. But rather than the refugee camps, you have slums, but most of the world's population is now urban. And therefore, scorched earth policy necessitates the dismantlement of the health system. If scorched earth policy means that you want to make a piece of land or an area uninhabitable, then you have to dismantle the health system. And that's what we're seeing in Gaza, and that's what we see in other wars in the rest of the 21st century. We saw this again in Lebanon during the brief war. Over 240 health workers were killed in Lebanon. 18 hospitals were targeted in very similar ways to what was happening in the first 2 months of the war. And so my contention is that this is already becoming part of the Israeli military doctrine and will be taught in military academies across the globe as a way of depopulating a piece of land. What had happened in Syria and in the Ukraine and even in Sudan are attacks on health system, not belittling them, but they were attacks on the buildings rather than a systematic dismantlement. And unfortunately, they belong to the 21st century, and we will not see them in that limited form again. Sudan, for me, the most serious part is that you had a war which wanted to dismantle the state. And so the destruction of the health system in Sudan was part of the dismantlement of the state to allow a dissolution of Sudan as a central state. In Syria, the Syrian regime viewed the provision of health care as a central part of the legitimacy of the state and therefore fought against anybody giving health care because it viewed it as competition with the state. But in Gaza, it is part of the weaponization of every aspect of an ecology where people live, where the aim is to make Gaza uninhabitable, even if that means wiping out the population. So thank you very much for listening, and thank you.
So I'm going to sit here so I can see our panelists. Thank you, Ghassan, for that sobering analysis. And I think it's worth just summarizing your argument here, which is that we have seen attacks on healthcare in a number of places, Ukraine, Sudan, and Syria. Plus proche, comme ça. So we've seen these attacks in a number of countries on healthcare, but they have been relatively tactical, if you will. And what we're seeing in Gaza now is the destruction of a healthcare system as part of a long-term military goal of depopulation. And you have likened this to scorched earth policies, making a place uninhabitable. And if a place is an urban zone, then you will destroy the infrastructure that allows people to live there, which is not only healthcare facilities, of course, but is water facilities and the other infrastructures that allow us to live like in a city in Geneva. So I just wanted to, so what I'm going to do is I'm going to ask our panelists a few questions, and maybe I'll start you with Larissa about what have you seen? What has your research shown about whether attacks are indeed increasing? The scale is, in a way, what Ghassan's analysis is borne out by the the figures and the statistics.
Yeah, thanks for, as you said, that very sobering and very detailed discussion of what is happening. I guess one of the things that is really important to recognize here is that violent attacks on healthcare are not new. They go back decades, but they are getting worse. I mean, we are both paying more attention, which means we're seeing more examples, but we're collecting better data. And what that tells us actually is that the numbers are going up. It's not just about better data or more data. The attacks are increasing. As others have pointed out, 2024 has been the worst record, or the worst year on record, according to the Safeguarding Health in Conflict Coalition, with upwards of 3,600 reported attacks, resulting in over 1,100 destroyed or damaged health facilities, 927 health workers killed, 473 arrested, and 140 kidnapped. And I guess those last two parts bring me to another point here, which is that we tend to pay attention to the big destruction of hospitals, the striking bombings that happen. So we focus on the most egregious, and what we aren't paying as much attention to, or what sort of goes underneath those headlines, is things like health workers being arrested and detained, not being released, being kidnapped, the threats that health workers receive that have detrimental effects as well. The killing of doctors and nurses gets understandable attention, but it's also about the forced closure of hospitals, the prevention of access to patients on the part of medical personnel, but also preventing patients from accessing health care. So these are the other parts of the overall picture that have to be part of this equation.
I think one of the things I'm hearing from both of you is that one of the, I want to say good, it's not good, but one of the productive outcomes of these attacks is it's a multiplier effect, right? So you kill some people in a hospital, you wound a bunch of people, but then those people will die, right? Because there's nothing. So you're actually getting more for your buck for each bomb, essentially. Martin, I have a question for you, because one of the things that Ghassan has said and that is coming out of this discussion is if we are really, the question is, are we really seeing a new military doctrine, one that is being piloted and experimented in Gaza, but which will rapidly, we know that military innovations, when they are effective, they are taken up, they're rolled out. So Martin, you're a lawyer, you're specialized in international law, and I want to ask you, doesn't international law protect us against this kind of military strategy?
Yeah, no, it's a good question, Vinkim, and it's also the way I engage in this discussion. Like, very often in the newspaper, in a tweet from Dr. Tedros by the chief editor of the BMJ, over the last years, I've read the sentence that attacks on hospitals are prohibited under international humanitarian law. And it's great to use that line as a way of defense, of outrage on these attacks. But what we do see is that the actual law in which hospitals are protected, unless they engage in acts harmful to the enemy, is used more and more. And what we see is that countries are using secret military information to say that hospitals are used and defend their attacks in that way. And the problem with that is that it's not controllable. There's no need to make that information public. We cannot really ask those questions. Afterwards, if the information is missing, they can say, oh, we made a mistake. They change their information very often and say, oh, it was collateral damage, and we try to attack something next to the hospital. And as such, we're really in a situation we're saying that attacks on hospitals are prohibited becomes a very long debate of the law and effects on the ground. And that is definitely being used by many countries, not only by Israel, but all over the world.
So you're saying that it is legal to bomb a hospital if I claim secret knowledge that there's a military unit there?
Well, at least
but I don't have to disclose, so I can just say that.
You don't have to disclose until the court that comes in 5, 10 years. Frankly, I only know of one case in International Criminal Court that somebody has been prosecuted for attacking a hospital or a healthcare system in the 1990s, in Yugoslavia. So the law is flexible enough to get away with it easily if you're a bad faith.
Well, I guess that's what we're seeing. I remember the first sort of highly mediatized attack that was much discussed here was when the Americans bombed Kunduz Hospital in Afghanistan. When was that? 2015. And they said, oops, sorry, it was a mistake. And it was pretty clear that the hospital had been deliberately bombed. They knew where it was and so on. I mean, if we think about Kunduz, it is actually remarkable, right? The fact that this was actually a thing that was discussed, and now it's just, it is, I mean, Ghassan, I think you're right, obviously. This is now part of strategy. It's done in and out every day. So, Martin, what can we do to better protect healthcare systems?
Yeah, well, I think that this current rule system in which you can use classified information as a reason to attack a hospital, it's simply not working, right? Like, all hospitals in Gaza have been attacked. When you see the ministers speak, they come with a list of reasons why it was legitimate. So it's very difficult to analyze and say this was not allowed. Then we have a proportionality assessment that we need to do to see whether this military objective was proportionate to the amount of civilians that were killed. And this proportionality assessment is extremely vague in international law, and nobody's really providing clarity on what that is. And as we've heard, there's 1,000, 2,000-pound bombs being used. There's the last hospital that provides dialysis being attacked. There's quite obvious cases here where proportionality is completely not assessed. But there's nobody speaking up internationally to really set that line, to really set that standard. So we're really having a major gap.
Why not? Why is no one speaking up? Why are there not cases popping up everywhere?
It's surprising to me as well. Yeah. No, I think I think it's definitely a fear of changing this law as countries and not being willing to limit your own military capacity in that sense. And there's also a fear in organizations like the UN and the ICRC to really engage with this law and say, it's not working, we need to do something else, or we need to change our interpretation.
So the hesitancy to change the law in the face of its obvious inability to accomplish what it does, it kind of does support what Ghassan is saying, right? So I don't want to give up my future right as a nation state to use this strategy that Israel is employing to great effect. So that's one way to sort of link the two. But you've talked about ICRC. So ICRC, which is a Geneva institution that we all know and love. We all know the history of ICRC, the Convention de Genève. So ICRC is at the heart of this in a way. And I just want to hear, Avril, what you think about all of this.
Yes, I'm not a lawyer. I'm a health worker. And I've spent my whole ICRC career in the field until March this year when I moved to the headquarters. I still have the metaphorical mud on my boots, and I've been in many a context, including some of the ones that Ghassan mentioned. What I would say in response to the whole issue around IHL, international humanitarian law, Geneva Conventions, the rules of war. These are not an ICRC invention. Everyone who signed up to them, the states, the countries, all around the planet, all agreed, and that's what they signed up to. I don't believe that the law needs changing. I believe it's about interpretation, it needs reinforcing, and this doesn't come from you know, just lonely voices. It needs to be a political will, it needs to be states. And the reason that everyone signed up to the Geneva Conventions, which may seem very old-fashioned, I don't think it's old-fashioned to say that absolutely everyone has the right to health care. ICRC was born on the battlefield, and it wasn't about civilians, it was about military. Wounded soldiers have a right to health care, and then it developed. And the fourth Geneva Convention is about civilians are protected. It's not just about not attacking healthcare, it is about protecting healthcare. It's not, you have to actively protect healthcare in war. And battlefields used to be fields, and now they're urban centers. Now they're end referral centers. And as Dr. Ghassan mentioned, it's not just about people getting wounded. Someone who has diabetes isn't going to suddenly be cured because there's a conflict. If you have high blood pressure, believe me, it's not going to get any better if you find yourself in the middle of a war. So the rules of, not the rules of war have not changed, but the way conflicts are managed has changed. Drones. I was in Ukraine until January this year. I was there for a year. In 1 year, I saw such advancement in terms of how drones are used. We have lost our humanity, and that's what we need to get back. A drone it's not this close combat. It's someone sitting, maybe they think they're on a video game. I don't know. But we need to bring it back to humanity. Humanity, humanitarian, it's about being human. There is not a single person on the planet doesn't need health care. And there's the immediate impact, but of course there's the longer term impact. It's not just about training somebody for 12 years, which is a very long time. You cannot train experience. You never get that back. And it's also not just about the physical toll, it's the mental health of healthcare workers. I've worked with a surgeon who found himself frozen years after a conflict, another context, where he had a gun to his head in the operating theatre, and he suddenly had that PTSD type episode. People don't suddenly just bounce back. ICRC also has a field hospital in Gaza, and we have many, many operations around the world. And there is a genuine concern for health workers about the mental toll that is taking, and that often is unseen. So I think the biggest concern, if you like, is the hollowing out of laws that everyone signed up to. And at the minute, the ICRC is working on a global IHL initiative, and one of the work streams is on hospitals, not just hospitals, but healthcare, bringing states back around the table and saying, you signed up to this, now you need to recommit, and now we need to be clear about what we're talking about. Because everybody needs healthcare, and when healthcare is attacked, everybody loses.
So an old-fashioned view. So what you're saying is we just need to go back to the values that were behind those laws. It's not a question of changing the laws. Ghassan, what do you think? Where would you weigh in here?
So I think we've all seen the marginalization of the International Court of Justice after it issued its ruling on the plausibility of genocide, and then what's happening to Karim Khan at the International Criminal Court and the pressure that he's being put under to stop the ICC from prosecuting Israeli leaders. What drives and what has always driven Israeli policy and other policies and Russian policy is impunity. State impunity, but also more importantly, individual impunity. When I am a tank commander firing at a room that I know is where the MSF doctors in Al-Auda hospital sleep so that I can kill 3 of them, I need to know that in 30, 40, 50 years' time, as I'm pushing a trolley across the supermarket car park, nobody's going to put their hand on my shoulder and arrest me for war crimes. And that's what we need to be doing. We need to be going after the individuals who are committing these crimes, because at the end of the day, these are crimes. They're war crimes, but they're crimes. There's the crime of killing. There's the crime of killing multiple individuals. There's the crime of causing the death of individuals by denying them access to health care. And so as some of the foundations that have grown out of the war in Gaza are trying to do, like the Hind Rajab Foundation, the humanitarian sector needs to try to put the fear of God back into military and political leaders by going after individuals in local courts. These individuals who've bombed hospitals need to know that there is an organization within the humanitarian sector who is scouring the internet looking for their name so that whenever they try to travel, they end up on an arrest warrant and they get taken to court. Because these states, the same states, are preventing international law from being applied. And what we, within the humanitarian sphere, have left are local courts. And we should be using these local courts.
Very interesting point about strategy. So I have a question maybe for the panel. I'm just wondering myself. So one thing that I don't know if this is reported or documented, but I have connections and one of the things that has been, so you have, for example, very low-level Israeli officials who are doing things like making not approving vaccine shipments until they're expired. You know, this kind of thing to not sabotage, but inactivate humanitarian aid. Does that qualify as a war crime?
Yeah, I mean, I think what we've seen with Israel is that they are very aware of the law. They're very...
but there's impunity, right?
Yes.
So we have these declarations of ministers and so on that you would not make if you were afraid.
Yeah, so I think plausibly it's a war crime, but like showing that, having the evidence, showing that they did not make a mistake, which happens in bureaucracy all the time, but that this was intent, that is the way that the law is strict and played. And that's what we see in all areas of law, I think, in this specific conflict. And this is rather unique, yeah.
So, I mean, if I can add, we know the name of the Israeli tank commander who ordered the killing of the 12 paramedics and ambulance staff in Rafah a month ago. His picture is known, his face is known. What is needed now is action in every available jurisdiction that this man will never ever travel in the rest of his life, and that there is an arrest warrant in his name for the crimes he committed. It's, you know, the flip side to that sense of impunity is how self-advertising a lot of these perpetrators have been in the genocide in Gaza, on social media, in the newspapers, in interviews. And so we go back, the enemy is not the vagueness of the law. The enemy is impunity. The enemy of I mean, we saw how there has not been any serious attempts at going after, you know, military leaders in the war in the Ukraine in any serious way, because it's viewed to hamper any possibility of a peace talk. But at the end of the day, at the local level, within the humanitarian sphere, we need to free ourselves from this idea that the states, who are by and large the perpetrators of these crimes, are going to step in and end this. Because as someone said, the problem is that they will not stop other states committing crimes in case they feel the need to commit these crimes in the future.
So Ukraine has come up, and I wanted to circle back to Ukraine. I think one of the things that we're hearing is the novelty or the innovation in Gaza, and this idea that Gaza is a laboratory for a new way of waging war. And I think that's an important point. It's an original point we haven't heard about much, which really points to Gaza as a historical turning point. And I wanted to find out a bit more about how Larissa and Avril, how can we see a difference in what happened between Ukraine and Gaza in terms of targeting healthcare facilities? I mean, you were there with the Red Cross. Do you feel that Russia, which obviously I think we can all agree with Ghassan, that Russia is presuming impunity, is that visible in terms of war crimes, attacks on healthcare? I mean, we've heard about Bucha and many other places, but is there that systematicity there?
I think we, certainly speaking as ICRC, we need to be very careful about what is a direct targeted attack and what is an impact of the hostilities on a hospital. It's very, very difficult, and it's not for ICRC to prove intent or who did what. All I will say is that for me, the big change I've seen in recent years, and it wasn't just in Ukraine, it was previously, is the advancement of drones. I think that drones have become, we think of big ballistic missiles and bombs, but the sheer number of drones and the terror they can wreak on that whole kind of population along the front lines is very sinister. But when a hospital is hit, it may not have been the hospital that was directly targeted, and it is not for the ICRC to say who was targeted. I think also I would like to mention that I find it interesting to say that humanitarians should take people to court and it would free us. I don't see it that way at all. As humanitarians, our job is to understand the humanitarian consequences of the conflict and to help the people. We do not need, if we come as we're going to also try to have a legal side to all of that, we would not be allowed to do our job, and it would stop us doing our job. So certainly for ICRC, our job is to focus on the humanitarian consequences and to mobilize states which ultimately have the power to ensure that people hold themselves to account. But it would be very damaging to our humanitarian sphere, if you like, to then be, oh, if we see an attack now, we're going to take you to court. That would never work. It wouldn't make sense for us, and I would see it as a burden rather than freeing us. ICRC is very specific. It's maybe others feel differently, but for me, humanitarians need to focus on the humanitarian work. That's just how I see it. Yeah.
Can I just build on that? Because I think one of the other parts of this is there's, attacks that directly target, and then there's attacks that affect healthcare. And the impact in that way, the impact is the same regardless of the intention. And so we have places also where the impact is greater because the healthcare system was decimated before the war or conflict began. So in places where there is no consistent electricity supply, if you, damage the solar panels that keep the cold chain active, then, and there's no way, the roads are not serviceable or passable, and you can't bring in new supplies or new medicines in order to repair that system, the impact is going to be far greater than it would be in a place where you have a functioning electricity system. So in that way, the impact of attacks is also contextual. And the changes that individuals make in response to attacks, we've seen from our research in different places that violent attacks, they cause women, for example, to try and schedule C-sections because they want to be able to plan when they're going to be at a hospital. They don't want to just be forced to go when they're already in labor. And we have, we've documented the way that vaccination campaigns can be affected by attacks on health. So, yeah, there's many different domains and many different ways that attacks can have an impact on the population, not to mention the impacts on the health workers themselves.
We've talked, there's some figures that have been circulated. So we have the death rate of healthcare workers in Gaza is how many times? 2.5 times greater than the general population. Latest figures are that 1/8 of the population is now dead. I'm just wondering, Larissa, is there a kind of a forensic epidemiology that is tracking this? Are people looking into this?
So we're tracking it, but as Avril was saying, that trying to distinguish, as an academic, methodologically, trying to distinguish between the impact of an attack and the impact of hostilities more generally is extremely complicated. It's virtually impossible.
But aren't there sort of, this is all a gruesome accounting, and my apologies to the audience, but don't we have figures for kind of a normal civilian death rate in a war? And you see what I'm saying?
Yeah, I do, and I guess at the risk
acceptable rate of killing civilians.
At the risk of bringing or using a very academic answer, it depends. So
are you an epidemiologist?
I am not. I am a social scientist, but I do know that there have been attempts to do this, but it is also extreme. The quality of the data that you need to have to be able to attribute that causation is very rarely exists in a conflict setting, in part because people are focused on providing care.
Yes.
They're not as focused
collecting
on
data.
that documentation and data. Yeah.
So that I was going to say that we can open the floor for questions.
Any questions or comments? Yeah, there are a few microphones going around. So just raise your hand and then we can bring you a microphone. Ouais, je peux peut-être prendre les noms. Oui.
Thank you so much. Oh, well, it's loud, sorry. Thank you so much for the panel and also for the testimonies and the analysis and everything. I just wanted to come back on the responsibility of humanitarians, and it's something I thank you for your answer, and I understand what you meant by that, but I think it's a concept that I really struggle with, because, for example, if we look at the Hippocratic Oath that all doctors are meant to take, it says in there that we should protect our colleagues and their families, and in a situation like that, I really struggle to understand how, as healthcare workers here in Switzerland, or like humanitarians that go work on the field, how can we not speak out for our colleagues, and how can we not hold Israeli accountable for what they're doing? And when we're talking about this impunity aspect as well, I think there is a responsibility as healthcare workers, not as any civilians or anything, but as healthcare workers, and maybe not as humanitarians, but when we are in this field, we have like a different responsibility, I think, to other individuals. And I wonder how can we speak out to our institution or to our country with this hat to say that we want to protect our colleagues and their families against these atrocious attacks. Thank you.
So, where I kind of disagree with some of my colleagues is that what I'm trying to say is that this is a historical turning point where the hospital has become a critical part or a central part of the battlefield. And therefore trying to pretend that collateralism, attacks on buildings is actually not going to equip us for what Gaza is going to create in terms of a model of conducting war. And again, we go back to impunity, and again, we go back to basics. So there is evidence from Palestinian human rights activists and Israeli human rights activists that Israeli doctors were present in the torture in Sidi Tinman, in the notorious internment camp. And yet, despite this, the World Medical Association refused to sanction the Israeli Medical Association. And I can only speak for the UK. The British Medical Association has failed to highlight this. And the different medical institutions have failed to highlight this. And so it is just as important to apply these sanctions on medical institutions in a country that now centrally, you need to create deterrence. Deterrence is the lack of impunity. You need to make the price for committing crimes high enough for everybody to not do it. And part of that is going after individuals so that they don't commit crimes, and part of it is going after health systems so that they do not engage in any way in participating or supporting these crimes.
Thank you.
If I may just add.
Yeah, please.
So just also to explain that different organizations work differently from each other. It's not that one is right and one is wrong, but they are complementary to one another. The way the ICRC works is we are not silent. We speak directly to the different parties to the conflict. So when we see what we see, we go to them directly. In many cases, if we were to, we have different Human Rights Watch and different who are very vocal and very much in the media. But if we all did that, there would be contexts where none of us would get in. We wouldn't get any access. Again, it's not right or wrong, and we have spoken about a number of conflicts, and it's very easy to find in the ICRC website. And recently, our president had an interview with the BBC specifically on Gaza. So it's not that we are silent, but we're very measured about how we do it, and we absolutely bring time and time again where we see different violations all over the world to the people that either were seen to be responsible or did not protect sufficiently to remind them of their obligations, including written interventions. Yeah.
Thank you. A few questions over there. The man, black shirt over there. Yes. Raise your hand so we can see you. Perfect.
Thank you very much. Number one, thank you very much for the debate, and thanks, Dr. Ghassan, for your presentation. Two things. Number one, we didn't talk about Sudan and what's happened in Sudan. I think it's good to hear from you about Sudan, because I think Sudan is a major thing which people are forgetting about simply because we have Gaza. That's one. Number two, I think I'm old enough now to realize that United Nations and its 33 set of organizations going with it is actually, they are the ones who are lacking truly humanitarian aspect. I mean, Rafah, they can easily, forget the Arab countries, easily can get through Rafah if they wanted to. So I think the talk about saying that United Nations is really looking after the Gazans, I'm sorry to say that is talk in the wind. That's not the reality. Reality is something totally different. So I think it's important for you to respond to that. I mean, talking about BBC, talking about CNN, all that nonsense that we hear, we know they are all afraid, saying what should be said, and it's only lip service, but reality is something totally different. So we've totally lost our humanity when it comes to what's going on in Gaza and in Sudan, and actually, if we want to go, Russia and Ukraine too. But I think it's important to bring that out. Thank you very much.
Thank you. Ghassan?
Thank you. I mean, you're right, Sudan is very critical, because, I mean, Sudan is a place where, in order to destroy the state of Sudan, they went about destroying its health system in order to create a kind of post-state anarchy where these groups are there. And what is devastating is we know who are the funders of the groups that were attacking the hospitals and the countries that have been funding them. And bizarrely, they're even within the UN system sit in leadership positions within the Human Rights Council and within the infrastructure. So Sudan is really a critical component in trying to understand how attacks on healthcare are not by default, but by design and even integral to strategy. The United Nations has failed to initially not just defend the Palestinian people, but also defend its institutions. The United Nations has failed to defend UNRWA. UNRWA was singled out by the Israelis not because of anything other than the fact that UNRWA was set up for the service of the Palestinians and insists on the resolution of the Palestinian refugee problem as a precondition for it to be dissolved. And so the UN failed when these attacks were being made on UNRWA, failed in defending its own staff, and then failed in defending the Palestinian people. And that kind of complete failure is a point in which the question is, and it's always difficult even to reconcile oneself with this, is that, the genocide is going on as we speak. Nasser Hospital, although hasn't been shut down by the Israelis have declared the surrounding area a military zone, and so ambulances and patients are not allowed to go in and out of Nasser Hospital, the remaining hospital in the whole of the Gaza Strip. But at the same time, you kind of wonder what of this post-Second World War architecture is going to be left after Gaza. So that architecture of UN agencies, of international law, of even the founding myths of the post-Second World War European state, and these myths were about liberalism and human rights, the tools of foreign policy, European foreign policy, that relied heavily on the ideas of the rule of law. All of these have been sacrificed willingly to protect, not Israel, to protect the genocide, to ensure that we're here almost, 20 months on a genocide that is not even slowing down. So once that genocide ends, in whatever shape or form it will end, these states will find that they have completely destroyed the very tools that they would function with, and shelled out and eviscerated the institutions that they had created, and allowed a genocide to become the vehicle for the return of fascism as a mainstream acceptable political ideology, as we see in the United States, as we see in a lot of European countries.
Thank you. Raise your hands. Yes, please. Microphone. You've got it. Okay.
Yeah, thank you to the whole panel. I'd pick up on the theme of the first two questions and think about the etymology of the word human or humanitarian. And in two ways. Ghassan, you made a very good case about the military doctrine of scorched earth supporting genocidal policy behind it. I wonder if you and the panel can think a little bit deeper even then. You just mentioned ideology. And Avril, you mentioned that all humans need health care. And I believe, and a lot of people I think believe, that all humans are equal. But there are some ideologies out there that suggest that not all humans are equal. And that's necessary also for genocides. We've seen that in other places. And it might even be necessary to justify humanitarian interventions not speaking out in solidarity during a time of genocide, not least of all during the Holocaust. So I'd like it if Ghassan and any others on the panel could reflect about the ideology, like Zionism, that's behind the policy that drives the military doctrine.
So it's interesting. I think the brutalism and the performative nature of the genocide and the violence of this genocide was necessary to allow the anti-humanist characteristic of this current wave of right-wing resurgence. That brutalism that was so performed on our phones and on our TVs and left unchallenged is critical. And what we see in terms of ideologies, and this is the bizarre thing, is that we see an almost a unified front appearing between Zionism, Zionist organizations, and the far right in Europe and in the United States, and a redrawing of historical concepts that, you know, I mean, for me, the world ended or changed, or I realized the world changed when the Anti-Defamation League, which is the most pro-Israel organization in the United States, referred to Elon Musk's Sieg Heil salute as an awkward shoulder movement. And so you realize that there is a kind of anti-humanist coalition that is appearing as a result of this genocide and its performative brutalism. And that brutalism allowed, whether it's the kind of us getting used to this idea or was there from the very beginning and allowed this to kind of almost become a self-fulfilling prophecy.
Mm-hmm. Thank you. On this side, any questions? Yes, please. Yeah, just raise your hands so we can see you. Yes, two men here.
Thanks, Josh Lyons. I did want to just sort of circle back to the central function of the workshop tonight, which is the thematic of attacks on medical facilities. And perhaps if we can distinguish the two subjects, which are the specific conflicts of Ukraine and Gaza, of which are in our minds and our hearts every moment of every day, and the issue itself. And I guess I would argue that for many different reasons, both political and militarily, those two conflicts are very unique and distinct. And they're not representative of the preponderance of ongoing armed conflicts in the world, where attacks on medical facilities and educational facilities are not just routine, but in many contexts, systematic and widespread. And when my children ask me questions about Gaza and Ukraine, I feel sort of paralyzed, because in many ways, diplomatically, politically, from a humanitarian standpoint, we are powerless. And this engenders a deep sense of helplessness and despair. What moves me is not that there is going to be a magical solution to Gaza and Ukraine, because I don't see that. There are, however, a multitude of conflicts that are not reported, that are underreported, and largely invisible, where there's profound suffering and hospitals are under attack, where I believe there is genuine hope and diplomatic and space to move European countries, the Swiss government, to exert significant political pressure and diplomatic pressure on those conflicts that are not reported every day, that would have a profound impact on medical staff and on outcomes. And I just wanted to highlight one of the worst conflicts that is completely invisible, which is in Borno State and multiple other states of Nigeria, where the Nigerian government has been waging a scorched earth campaign. They have destroyed hundreds of thousands of homes, thousands of medical facilities and schools, And this is largely supported and aided and abetted through European member state military support.
Thank you.
This is something that we could easily solve if we only brought attention to it.
Thank you. Yes, please. Just follow.
Thank you very much, all of you. Two questions, 2 comments, actually. You mentioned, Mrs. Fat, that the numbers, the attacks on healthcare is since forever, but it's more aggressive now. Do you have numbers of the percentage? Does it increase like Tesla shares, whoosh, like this? We normalize attacks on healthcare, or it is within the norms? Because what I see that the numbers are increasing every year, if I say, but I could see the last 10 years, not more. So if you have any numbers, please provide us. And Martin, I know that IHL is very vague, but I'm afraid that we live in an anarchic world where in Switzerland the judge tells me what this article says, but on a global level, on an international level, it's politics who says. So we could sanction a state for an act, but defend another state for the same act just because it has a powerful lobby or because you have a relation with it. So I don't think the problem with the values, with the articles of the laws, but it's with the implementation, that the fact that there is no power above the states. So each one manage its ways, navigate its ways through its relations, not through the rules or the values. Okay. So I think that is the major problem. But one solution I could propose of the Syrian NGOs who followed criminals outside Syria using the universal jurisdictions, and there are few facing trials. Some were received, like one of them was sent to jail for life in Germany last week, the same country that wants to host Benjamin Netanyahu in spite of the ICC warranty. So I think there are solutions probably on using some jurisdictions ways on a national, but using the universal jurisdictions ways. And last message, it starts with the message before. Dr. Ghassan mentioned
very quickly, please, because we've got that much time.
I think it starts also before the war with the information. When we say, when a Israeli doctor says, attack the Shifa hospital, when Assad calls the uprisers, the people protesting when it was peaceful, germs and viruses, bad ones that we have to fight them. Sometimes it really starts with social media, with the information, with the news. So every one of us has the role to play here to humanize everyone. No one should be a subhuman toward the other.
Thank you.
And I think that is a role for every one of us.
Thank you.
So I think if I understood your question right, you were asking if there was a very sharp increase in numbers or just a more sort of gradual. I mean, over the past 2 years, there has been a very sharp increase. So from 2022, I don't remember the exact figures, but 2022 to now, it's something like a 60% increase. But it was less from 23 to 24. A large portion of that increase is due to Gaza, but also Ukraine, Myanmar, Sudan. So there's a number of conflicts that have there have been widespread attacks that have created an increase in the numbers. And the SHCC reports are all available online, and you can actually look up those numbers.
Thank you. Thank you.
Can I just respond to the gentleman before? I totally agree with you. One of the biggest problems, and this is something I faced personally, having gone from the war in Gaza to the war in Lebanon, is that Gaza becomes the benchmark by which we measure horror. And we kind of, if something doesn't match up to the horror of Gaza, then it no longer merits our attention or our intervention of any sort. And I mean, for that point of view, I completely agree. The horror of Gaza should never be allowed to become a benchmark for what we find acceptable, as long as it doesn't reach the levels that we are witnessing in Gaza.
So I just wanted to note that this has been a very serious panel about serious issues and very difficult issues. And what, if I were to summarize in 3 sentences, one of the things that is emerging from this discussion is that we are in a kind of an in-between time, right? We don't really know the world we're going into on many levels. And I think Ghassan said something very important, which is the collapse of liberalism and humanitarianism, that we're the collapse of global health. So we're really in a really crucial time, and it's a very difficult time, and we still need analysis. I think that's what we're hearing. We are not equipped yet with the institutions, the laws, the mechanisms to protect ourselves and our populations in this new world, but we need to keep talking, and we need to keep thinking. And I'm very grateful to our panelists for that. And I think I want to salute Ghassan, who is a physician and who finds the time and the mental and emotional space to be cool-headed about what's going on, and others as well. And this is really important to have this space of critical, thoughtful reflection, which does not detract from the moral outrage, but we need this space. And I wanted to thank Karl and the Université de Genève to have furnished this space, and our panelists. Thank you very much. Thank you very much.
Thank you very much. We're going to close here. I really sincerely thank Dr. Ghassan for being with us and sharing your views. And Martin, Avril, and Larissa, really to bring your expertise and sharing that with us as well. Thank you very much. And we are very pleased to co-organize that with the Goethe Institute, but more specifically Vin Kim, who is a key thinker in our community, and it's a great pleasure to organize that. I also want to thank Alexandra Mondolfia at University of Geneva, who has done fantastic work. So thank you very much to the two of you. Thank you.